Eve, it's great to have you here in New Zealand. Could we start with your personal story first? And my understanding is that you had your first abortion at the age of 16.
Yes, that's true. I had my first abortion when I was 16, and then later at 21, I had another abortion. And I thought I was perfectly within my rights to do so.
Why did you think that? Was that the message that women are given?
I think that at the time, especially, I was in the milieu of the pro-choice perspective and thought that it was within my rights to do that.
If someone had come along and said, look, Eve, what you're doing is not right, would you have listened to them, do you think?
I think not without some personal impact, and the Abortion Breast Cancer Link is that impact. I believe that it would have made me think more carefully, especially since there are a lot of things that women are not told about the history that is still in their future.
Okay, let's come back to that link in just a sec, but that experience of abortion, many people say that it's just like going to the shop and buying some goods, having an abortion.
That it's safe, easy, and...
From what I've read of your experience, it was anything but.
Right, exactly. Leaving aside anything else in the way of breast cancer or whatever, the abortions themselves did tremendous damage to my reproductive system. And I had cervical damage, I had uterine damage, all kinds of things. And you don't know it. It's something that you can't know until you want to have a child. And then it turned out that I had 11 pregnancies. In the providence of God, I have one healthy son, and I'm very happy about that. But it was very difficult because I lost so many children as a result of the problems I experienced.
You see, I read the account of when you had the abortion, and it sounded like you were at a meatworks.
Yes,
It was so impersonal. In fact, the surgeon walked out because you were crying.
Yes, exactly. Women are not all the same size internally, and it turns out I was particularly on the small side, so the equipment was way too large and caused exceedingly a lot of pain. I was and crying and, really upset. And it disturbed him, so he walked out and left me with all this equipment inside of me.
So the whole procedure was so impersonal. It was literally like a
meat market. Yeah, it was really horrible. No
counselling beforehand or after?
That's correct. None.
The effects, I've read some of the research on the effects of abortion. I mean, I've seen research from the University of Texas, 65% more likely to experience clinical depression. There was some research, a French study, which said that abortion puts the next baby at risk.
Absolutely. 59 out of 59 studies, including a very important French study, show that premature birth is a risk factor. Even just one abortion, in those 59 studies, even just one abortion increases dramatically the risk of having a premature birth.
Okay, also the Medical Science Monitor said that 36% of women had suicidal thoughts, and they didn't think they'd been adequately counselled.
That's right.
Did you have suicidal thoughts?
Oh, yes, absolutely. Especially after the first one was very bad. I was thinking that I was a worthless person. In the second one, it was worse. I thought, well, that time has passed. I'll do another, and it'll be okay. I was a child, and even though I didn't believe in God at the time, I felt that someone had died, and I couldn't figure out. If it was only a blob of tissue, why did I feel like I was attending a funeral every day? Those suicidal ideations have increased dramatically because abortion has increased dramatically worldwide. And women are not getting the services they need because doctors are not trained to deal with the trauma, the horrible trauma that women experience after their abortions.
Were you able to talk to anybody about how you felt after the abortion? Or did you think it was just you that had the problem?
It was my personal problem, and I'm not usually open as I am being today about my reproductive history, but I feel it's important for other women to know.
Okay, but if there's research that says that abortion puts the next baby at risk, this is a major French study, if women are feeling suicidal, getting into alcohol and drugs, anxiety problems, in the Journal of Anxiety Disorders, if that's happening, why aren't women being told that?
I think a platform needs to develop, and perhaps your program will encourage women to help other women to create a platform. The problems for soldiers, for instance, who had post-traumatic stress disorder didn't come up until we had an anti-war movement that kind of gave it a platform to express itself. And that's what we need now. We need women to stand up for other women and say, this is happening, and women need to come forward. If they're not able to come forward because of shame, because the community does not accept women and enable them to open up and give that information, then the platform is not there.
Right.
And there's no way to help them.
Okay, can women talk to each other about it? Like, did you find other people in a similar situation? Was there that honesty amongst women?
No. How would you find them? There's no place to go.
So it really is swept under the covers.
It truly is. And now I know that there are more and more places where women can go for counseling, but 78% of abortions are done in developing countries, and certainly in those countries, those women have absolutely no help available to them when the traumas begin after their abortions.
So you had to deal with abortion at a young age, you had to deal with the physical and the mental repercussions afterwards, and then you had to deal with breast cancer, didn't you?
Yes, I did. I had breast cancer twice, and once in 1999 and then again in 2001. I lost both breasts in the second event and had implants, and the entire process is very debilitating. It absolutely shatters your femininity and ruins your self-image, and it takes a mighty God to enable you to come out of that, and certainly support. It's awful when you work through something like that by yourself and have no support. At
what point in your life did you become a Christian?
I became a Christian 2 years after my second abortion.
So before the breast cancer?
Yes, I was already a Christian at that time.
So did that help you deal with it?
Absolutely.
Did you think it was a judgment?
No.
You got breast cancer because of abortion?
No, I did not. Well, no. It turns out that I believe that it is a result, but I felt it was a repercussion of my own health habits and so on. So I certainly didn't blame it on God.
Okay. You say that one of the key messages that is not getting through, though, is the after effects of abortion, and especially breast cancer. Yes,
and that is critical. I'm so glad you've mentioned that. It's important for women to know that, for instance, in my situation, family history really has, there's a link between abortion and breast cancer, and family history of breast cancer really elevates your risk. In my particular situation, my grandmother died of breast cancer. My mother then developed breast cancer, and a cousin younger than I, a year younger than I, died of breast cancer. But all of these things were still in the future at the time that I had both of my abortions. And I had no indication that that was going to happen because my history was in my future. So I think women, I know I certainly would have considered, and I think maybe not gone through it, if I had known that there was a possibility that my family history would affect my living and outcome. If I would lose my breasts or lose my life, I think that information is missing for women. And in this particular situation, most women don't know that there is a link between abortion and breast cancer, and that family history plays such an important role. For instance, when I had my abortion, my doctor didn't ask me about family history of cerebrovascular disease, which would, cause me to have a blood clot, which I developed. I got a blood clot in my eye, and it was really bad. I almost lost my vision. But I didn't know that my dad was going to have an aneurysm of the brain. So we have that in our makeup, in our family genetic makeup. And those kinds of things were never told to me.
Okay, when we come back, let's talk about the link between abortion and breast cancer. How do you know that for sure? Because it is disputed. And also, let's talk about why the fact's being covered up. My in-studio guest is Sanchez. Back in a moment.